In what
Okay.
ways can substance abuse affect Yala youths in the area of health and wealth?
100%. There are many ways that it can affect them in the area of
Health
health and wealth.
and
Of
wealth.
course, yes, of course, they say a healthy nation is a wealthy nation. When Yala youths are healthy, Yala will be wealthy. Those days, we were both academia and we also do farming. How many of them are going into farm these days? First of all, it is start from the home. How many people can even wake up one day and follow their father to the farm these days? It is very, very rare. And that is why you see that currently in our nation, there are a lot of opportunity in agriculture, but there is a shortage of food. Are we in Yala supposed to be crying of food when others people, or when other areas are supposed to be crying of food? We are the oracle of yams. We are the owners of rice and all those things. Abakaliki people come and buy this rice, go there and process them in their state, and they call it Abakaliki rice. Meanwhile, it comes from us. We are not supposed to be crying for hunger. So, but these days, you see youth engage in activity that I visited Yahe. In my brother hotel, I saw a group of guys, young guys. Some of them were below 18, more than 20. They came in and they now, one of them, I think those guys are in court of kind of. One of them now gave money to once more and that they should go to that Boki by Susu place and buy ice. So me, I don't even know what was ice. Even though I'm in the medical field, I don't know what was ice. So the guys, when they left, I was now asking my younger brother, what is ice? That is, Igbo people used to call it mkpuru. That is a block of ice. So, or a tablet of ice. So that was what Igbo people normally call it. So I was now looking at them. Health-wise, these guys were not good, but I don't know that this will have a severe impact in their life. You see that some of them at 30, they will not be working properly. At 40, they will be having a lot of failed organs. Even in alcohol these days, there are a lot of fake alcohol. Some of them is not enough that they drink alcohol. They will go and mix it up with ethanol, methanol, and all that just to make it stronger. And all this will have effect on the liver and on the heart. Once the liver is affected, of course, it will affect the kidney. It will affect this other one. And you see that somebody who is plumb and healthy from the beginning, you see them, they develop some kind of future. Like some of them, you see this local Jinogogoro will make them to fat and look fresh in one way that you think these people are enjoying. But that is the stage at which their liver has deteriorated. And if you look at these things are happening in the village, you see someone will drink alcohol or will grow to the point that the jaw will now be growing big and looking fresh, and the eyes looking as if he is not healthy. The liver has failed. The liver has worked beyond capacity, and therefore the liver cannot extract out these toxic substances from the system. That is why those things are now manifesting under the skin, giving that person that look and that appearance. But because of ignorance, they don't take these people to the hospital. And in the process, some of them, they don't last long, they died. I have two uncles that have lost their life in the village. That one started from Lagos. They took him to the village. I went during December. I said, see, your health is failing you. You are going already. And when my elder sister now say, he's getting better. That somebody that when they brought him from Lagos, he was looking very lean. That the guy is adding up weight now. I say that is not weight. His liver has failed. And it wasn't up to 3 months when I came back to my base. I heard that the guy died. Okay, why did he die when he was healthy? According to their own judgment. So that is a loss. It's a loss to the family bonding, emotion, his own contribution to the family is lost. He has a son. Now that son somebody has to raise that son. So these are some of the challenges that we are having. So they need to avoid this thing totally. They need to avoid it. And there are ways to go about them. There are a whole lot of ways to go about them. Okay, when we were in the village, when we were growing up, some of these things there exist, but we pay attention to them. We don't. Our mind is not there. Our soul is not there. Our own is read our book, go to school. In fact, it's as if we're pursuing each other. we just want to be successful. That is our own mindset. And I think we are doing some of these things those days. Some of us might not be alive again because the body system is designed for natural things. When you introduce a foreign body to your body, you are killing yourself, subjecting yourself to even ordinary malaria will bring you down, and you are gone. So a healthy individual is a wealthy individual because, like those ones that I said lost their life, had it been the family knew that they will take them to the, of course they will spend money in the hospital, spend the resources, the little resources that they earn in the hospital to take care of these people, and whatever you lost can no longer come to your pockets. So that is just the thing. And again, we can help them, and the help we can give to them is to educate them of the danger. You know, some of these people, they are self-made lawyers, they are self-made chiefs, but they are self-made, I would like orators. That when you want to counsel them in one way or the other, they will be telling you, hey, my friend, leave that in, this and this. What do you know? This person has done it. This one and that one. But we still have to insist, and that is why we must start from the early age, or from the early stage. If you know the situation of families now in Yala, it doesn't represent who we really are. We are people that love and respect and listen to the instruction of our parents. But these days in Yala, and even not just in Yala, in Nigeria, it's no longer like that. Now you see the father and mother will go to bed by 8 p.m. and sleep, and by 1 a.m. their child is not yet home. And when that child came home, he will sneak. If it's a disciplined family, that child will sneak into the house. And by the morning, the parent might not even have time to see this child, question this child, and all that. They will just leave that child. He is grown up. Let him take care. You know, these things it has gone beyond control. So I don't know. The family system is broken. The family system is destroyed. It's totally destroyed. How many of the kids are going to church? Like those days, some of us we fight to be man servers. How many of the kids that try to take up these challenges these days is not there. So, and that is why we are having these issues, because where are they getting their information from? Where are they getting the idea from? Like they say, show me your friend and I'll tell you who we are. Do you know the friend of your child? Do you know who your child is going out with? Do you know what your child, the friend of your child is doing? They don't have academic friends. If you are a type that love academics, they will brand you with a name that will make you to lose interest in it. I know they call us, some of us, they call us many names those days. Abraham, I think whether he's online, they call us many names those days. Even you, they call us different names those days. They see us as lazy, as people that can't make it in life and all this. So that is it. But these days, who will take up those challenges? Is not there. So the family system has failed. I would say whether poor parenthood have actually affected the family system, and these kids are going on